My name is Jory Van Cleve. Today I'm going to be talking about plasma clearance. Before we dive into plasma clearance, we need to understand what the kidneys are and what their functions are. The kidneys are bean-shaped organs found in the excretory system. These organs have a huge job in filtering and eliminating waste from our blood. They're a natural filtering system for our blood. These wastes can include things such as ions, drugs, vitamins, as well as many other things. Once the wastes are filtered out of the blood through the kidneys then eliminate the waste through urine. Our kidneys receive a liter of blood every single minute. This is why our kidneys are so important. They are constantly filtering our blood and producing urine that waste are eliminated from. In fact, our kidneys produce around 1.5 liters of urine every single day. In order to eliminate waste from the body, our kidneys produce urine. Urine allows waste to be collected and distributed outside the body to prevent a toxic buildup. The three main substances that are excreted through the urine are metabolic waste, electrolytes, and water. So some example of metabolic waste that needs to be eliminated includes things such as urea and creatinine. Electrolytes include inorganic compounds such as sodium, potassium, calcium, and chlorine, as well as others. Urine is made whether there are wastes to be eliminated or not. Even when we're dehydrated, our body still produces urine. However, that urine may be more concentrated since there is less water in it. This color chart on the slide just can help determine a person's hydration. So the darker it is, the more dehydrated you are, the lighter it is, the more hydrated you are. Some different foods and medications or drugs will also affect the color of urine as well. So today we're talking about plasma clearance. Plasma clearance is also known as renal clearance, and this refers to the ability of kidneys to remove molecules and waste from the blood by excreting them in the urine. Plasma clearance is affected by numerous things. The three main things it depends on is glomerular filtration, tubular reabsorption, and tubular secretion. Each type of substance needing to be eliminated from the blood takes a different amount of time. If any of the three dependent factors change, the renal clearance rate of that substance will also change. These three processes involved in plasma clearance ensures that water and waste are the only things excreted from the body. And if you look at the picture, it just kind of shows the rat, and it shows like where his kidneys are located and bladder. It shows the blood flow through the Bowman's capsule and the glomerular filtration. It also shows the secretion and where there's not any tubular reabsorption. Glomerular filtration is the passive filtration of blood as it moves through the glomeruli of the kidneys. This is the first step in making urine. The filtration of the substance depends on its size, its ability to bind to proteins, ionization, polarity, and kidney function. As the glomerular filtration increases, the clearance also increases. Just like if the glomerular filtration decreases, the clearance will also decrease. This rate, the glomerular filtration rate, is one of the best tests to use to see what kidney function is like or to measure kidney function. Glomerular filtration can be calculated by looking at a blood creatinine test, the age of the patient, their body size, and their gender. Each kidney contains over 1 million nephrons, which each have a glomerulus. This structure is the site of blood filtration. So this is where the blood is going to actually go through and be filtered. Essentially, it's a network of tiny capillaries that are surrounded by a cup-like structure called a capsule. Most of us know this capsule as the Bowman's capsule. Blood begins to flow through the glomerulus as blood pressure pushes out water and solutes from the capillaries into the capsule, then into the filtration system. This filtration system allows water and small substances to pass, but it keeps a large proteins and blood cells from passing. So it wants to keep those inside. And in this graphic, you can just see the drawing of where those capillaries are found and the tubule, the capsule. It shows the afferent and the efferent movement. Tubular reabsorption is a second step in plasma clearance. This process moves solutes and water out of the filtrated liquid and back into the bloodstream. This is the second time the substances are absorbed into the bloodstream. So they were absorbed when we ate or when the person eats their meal, and it brings those substances and nutrients and things into the body. We cannot excrete every single thing we put into our bodies, though, or we would lose way too much fluid, almost 10 times what we put in. We would lose an extracellular body fluid. So the kidneys use the nephrons to help maintain body fluid homeostasis. And there are 5 different sections of nephrons that are responsible for reabsorption of different materials. This step is the second step in creating urine. The graphic on the slide depicts the different segments located within nephrons that deals with the reabsorption of different substances. So the proximal tubule, convoluted tubule, is responsible for reabsorbing substances such as glucose, amino acids, urea, sodium, potassium, phosphate, calcium, magnesium, and water. The proximal straight tubule is responsible for reabsorbing phosphate, while the thick ascending limb is responsible for reabsorbing sodium, potassium, calcium, and magnesium. The distal convoluted tubule reabsorbs sodium, calcium, magnesium, water, and urea. The collecting duct is responsible for reabsorbing sodium, water, and urea as the bladder reabsorbs potassium, magnesium, and phosphate, and a little bit of sodium, calcium, water, and urea. And of course, different areas within that nephron absorb different amounts of each of those things. So you notice that there were several spots that maybe water could be reabsorbed or sodium, but they're also in different amounts within those. Tubular secretion is one of the last steps in urine formation and plasma clearance. This still deals with filtering blood to help create urine that is used to eliminate waste. Tubular secretion is an important step in removing drugs, toxins, and poisons from the body, as well as excessive amounts of things such as potassium, hydrogen, and urea. The nephrons found within the kidneys also help with tubular secretion, just as they did reabsorption. The substances move from the blood through the capillaries and into the interstitial fluid. From there, they travel through the wall of the tubule and into the lumen. Once it leaves the lumen, secretion will take place at different segments of the tubule, just as reabsorption does. Most drugs and toxins are secreted into the proximal tube, where they then move into the urine to be excreted. In this picture, you can just see the Bowman's capsule, which is in green. You can see the tubular secretion, which is in that cortical vein right there in blue. And then you also had those afferent and afferent arterioles and the tubular reabsorption and stuff in red.